Welcome, everyone. And on behalf of the LGBTI Stakeholder Group, thank you so much for choosing to spend your time with us today. And thank you to the government of Netherlands, UNDP, UNAIDS, which have all co-sponsored this event. And happy day one of the 2021 HLPF. I mean, technically, the side event is before the official opening of the HLPF. So personally, I would say that if every UN meeting kicked off with a queer event, I mean, we'd all be in a better place, right? My name is Rashima Quatra. I go by she, her pronouns. I'm the International Advocacy Advisor for RFSL, the Swedish Federation for LGBTQI Rights, based in Stockholm, Sweden. And I will be your moderator for today in our discussion on advances and barriers on achieving health and well-being of LGBTI populations. Just on technical grounds, the event will run for 1.5 hours. We will have time for a Q&A at the end of our panel, so please feel free to write your questions either in the chat box or in the Q&A function that you will see on your Zoom screen. You are being recorded today, just to let you know. And let's kick it off. Joining me today are our wonderful panelists who I'm introducing just very quickly in speaking order. We have Hiker Chu, who is the Executive Director of Intersex Asia. We have Barbara Wangare, Executive Director of Ethan. Dr. Tlaleng Mofokeng, the Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Laurel Sprague, HIV and human rights activist, currently serving as chief of the community mobilization for UNAIDS, and Monica Tabengwa, program specialist with the Inclusive Governance Initiative Project with UNDP Africa Regional Office. I would be remiss to say, if I didn't say, actually, what a panel of absolute rock stars. I'm so happy to be here with you today, and thank you so much for joining us to share your expertise, your experiences, and for really spending this 1.5 hours to shed light on a way forward to achieving SDG 3 for LGBTI populations. I know that Dr. Tlaleng has to leave a bit early, so just letting everyone know that we will only have her for about the first half of the event. But thank you so much for being here. It goes without saying that the COVID-19 pandemic has had devastating impacts globally. It's been particularly difficult for communities who were already vulnerable, populations who have historically faced multiple or intersecting forms of discrimination, and of course that means LGBTI persons. The impacts of COVID have severely hindered LGBTI persons' access to health services, and have impacted our community's overall well-being, something that was already disproportionately impacted even before COVID. What we've learned from COVID is that it's made it really clear that deeper structural injustices have heightened the reality that in practice, LGBTI persons have been left behind. We know this to be true even before the COVID pandemic, and even though global data sources are scarce, they've all shown that the overall health and well-being of LGBTI persons is consistently poorer than the general public. In this context, and in recognition that we have 9 years left towards Agenda 2030, it is extremely pertinent and timely for us to discuss and for the LGBTI stakeholder group to hold this event to discuss the specific impacts of COVID on LGBTI persons, where do we go from here, and the overall health and well-being of our communities. I'd like to kick this off with our first question for Hiker. Hiker, I'm so glad to have you on this panel today. I remember we met in 2013 at the ILGA Asia conference in Bangkok when you shared your intersex story and really introduced intersex issues to the LGBT community at large at a regional level in Asia. I felt so thankful to have met you then and to know you now, as you've really pushed the visibility and recognition of intersex people, not only in Asia, but to the world, really. You've also been pivotal to the establishment of the first ever regional organization on intersex persons, Intersex Asia. And recently, the organization has released a report on the specific impacts of COVID on intersex persons and intersex communities from the region. Could you tell us more about the findings and the recommendations of the report? And what are the access and the barriers to access to health faced by intersex persons as a result of the COVID pandemic?
Okay, thank you for the opportunity. I'm Heike Cho. I'm from Taiwan. Yes, after all this year, working hard to try to reach out to intersex people in Asia, finally we have an Intersex Asia network started in 2018. And this last year, because of due to COVID-19, we aware that this impact is very severe to intersex people, and survey working with LGBT together maybe not not enough to express the specialty issue that intersex people face. So we decided with we're intersex activists together that we initiate an survey for intersex group specifically, and also based in the regional level. So this is the first kind of a regional level report done by intersex-led organization in Asia. Yeah, I think this is important. But since we are very young, and the movement here actually is kind of in the beginning, so it's still hard to to find so many intersex people to participate survey. But I think it's a good start, as a pioneer, and we discovered that how important to have an intersex organization and a network in Asia, because without this network, I don't think it will be possible. Yeah, so I was talk about that. Yeah, a few point that especially related with the health well-being issue, because this issue is the number one issue we highlighted in the report. Yeah, it's and so but still we also ask a question about the access to support and financial situation and housing, traveling, in education, personal safety, and intersex adolescent, any this kind of impact to happen to intersex people in Asia. And I think for all of this actually maybe not specific to about physical and mental health issue, but all of other impact actually cause, they are the cause of the mental health issue and mental health and well-being issue. Yeah, so, but in our discovery, we see that actually discrimination is a severe issue in Asia, because we discovered that during the pandemic, actually intersex people are afraid to go to the hospital because the social discrimination. It includes stigmatized and also social discrimination, because some doctors also discriminate intersex people, or when you go to the hospital, you will face discrimination from around, from people in around. So that is a big issue. And also discrimination also is one of the factors that impact intersex people cannot have a legal identity document. This is something that we found. Actually, we know that before, but we found that this is also because of discrimination from the family, because family feel shameful to register intersex people, for as to have an ID. So this is very serious, because especially during the pandemic, because it means that this person doesn't really exist. So how can the person get proper protection from any kind of protection from the government, including like accessing healthcare, and also health insurance, publicly or privately. And also, like now that vaccination is so important, if you have no ID, then you may be not included in any list to be vaccinated. These very serious issue. And also the trauma caused by the pandemic, it's really hard, but hardly any medical or mental health professional here is equipped with proper knowledge about intersex condition, not even mention intersex human rights issues. So, so we know that maybe in the world movement, depersonalization is the main issue for intersex movement, but actually discrimination is the roots of the personalization issue for intersex people. So because most medication actually try to pathologize intersex bodies, so to use the surgery to eliminate the social discrimination for intersex people, but actually it doesn't work. So this is very, very serious. And even like in India, actually cultural belief also impact doctors' treatment, such as intersex people. Their intersex baby was sent to Hijra community in India actually recently. These are something that we find the difficulty that to happen during the pandemic. Actually, some of the issue actually happened before already, but it just made pandemic make worse. And actually, in our survey, there are we discovered that there are 10 countries, people from 10 countries joined the survey, and 3 countries like Philippines, Bangladesh, and Nepal have more than 20% people in this survey, because this is because they are our member organization. So actually this survey we got very important support from the intersex organization in the country. And for other country, actually only 1 or 2 or 3 person joined the survey, very less. So for us, it's still very hard to reach intersex community in Asia. So this report showed us that there are still a lot of people that is left behind, and in our survey, we also find that 60%, more than 60% people also identify themselves as vulnerable group in the economic status, and also more than 40% identify they are vulnerable in gender identity and gender expression. So I think these are all related impact to our well-being as well, because during the pandemic, so many people lost their job and couldn't continue the education. And many people live in the rural area, remote rural area. They don't have internet access. So online education is kind of not possible, and it also impact our well-being as well. And also, the one of the big issue is that make this report this survey difficult is that we can only did a survey in English. So we need, we need our member organization leaders to, help to translate all the question and help to fill the answer for those people who have no internet access. So these language barrier and the internet resources, is also big impact to us.
Thanks so much, Hiker, for giving us at least some of the results that you had from the report. I think it was extremely important that you mentioned that the survey was conducted and led by intersex people. We know that intersex people in our communities are closest connected to our community, and for raising that some of the issues predated the pandemic, but that the pandemic caused vulnerability in other aspects of life as well, which just points to the interconnectability of all of the SDGs, because a loss in one impacts a loss in many of the others. I'd like to move on to our next speaker, Barbara. Barbara, you're the executive director of the East Africa Trans Health and Advocacy Network, which has 24 members across the region working on research, advocacy, capacity enhancement, and movement building, focused specifically on the health and well-being of trans, intersex, and gender nonconforming persons. As you know far too well, in the few spaces where there are even discussions and services directed for LGBTI persons, much of it is still focused on cis populations. And in this past year, trans persons have faced specific barriers to accessing healthcare due to COVID, and have had specific barriers due to COVID, with much of the needs unmet. I was wondering if you could tell us about the challenges faced by trans and gender nonconforming people. What is required to ensure that the needs of these populations are met? And how do we really center trans and non-binary populations in development efforts focused on health?
Yeah, thank you so much, Rashima, for this opportunity. And thank you to everyone for joining us for this. So the trans and non-binary community across the globe has experienced heightened challenges in respect to COVID and also just general health issues. But I think COVID has indeed exacerbated the challenges that are being faced by this community in many, many ways. I mean, we've seen quite a number of trans and non-binary people having to move back home, in order to adhere to the rules and the the regulations that have been put in place to try and limit the spread of the virus. And this issue about going back home, and especially with so many trans and non-binary people facing discrimination, facing ostracization from their own families, has increased the levels of mental health struggles that we're seeing in communities. And this is evident even when you look at some of the studies that have been done globally and even in our own continent here in Africa, that are showing that there's all heightened mental health struggles among the community just by being in a space where they're unwanted. We've also seen a lot of trans and non-binary people lose their jobs. It is once women in particular are engaging in sex work. And now because of the COVID-19 restrictions where you're not supposed to get close to anybody, and basically in terms of sex work, that's literally how you do your job. It then means that you're losing a significant portion of your income. And so that increases all these other situations and all these other realities in terms of poverty, in terms of having to find alternative ways of finding income for you, and having to maybe even go back home just so that you can be able to eat and exist and live, right? And so we're seeing those are the main issues that we're getting with the community that with the community in terms of poverty. And again, just a little bit about that also, we realized that quite a number of trans and non-binary people do have what we'd say like menial jobs or menial labor, something that's not permanent, you're not entirely employed, or you're self-employed and you're doing some informal businesses, which are also affected by the pandemic and the restrictions that were put in place. So there's all these heightened issues of poverty, of lack of access to income that again just exacerbates all these other issues in terms of their mental health and well-being, increased stigma and discrimination, and also just basically not being able to afford general health care, and especially even relating to like gender affirming care. Again, also the restrictions have made it even more difficult for people to be able to get, so those who are actually on hormone replacement therapy or in some form of gender affirming care, it makes it even more difficult for them to access these services and access their in much needed hormone care. People who had already saved up and booked appointments, surgical appointments for doing surgeries that would help them alleviate their issues in terms of gender dysphoria, found those particular appointments canceled, right? And so there's all these issues that not trans and non-binary persons have experienced. And it's all also added onto the existing stigma and discrimination that they had already been facing even prior to COVID. And so it just becomes even more heightened. And again, because of the focus on the pandemic, the focus has been shifted away from general healthcare and the health and the needs that a trans and non-binary people have and need to be provided with. And we've seen also like in terms of like the HIV programming, and we understand how the trans and non-binary community is affected by HIV and is a large driver of the HIV pandemic and one of the most affected communities under the key populations, so key and vulnerable populations in terms of HIV. And so we're seeing those are kind of some of the issues that you're facing, somewhat in agreement with what Hika is saying in terms of trans people not actually going ahead and seeking that provision of services, putting themselves in situations which are much more riskier, and just again making it more difficult for them to just live their lives, and all these things really have a huge impact on their mental health and well-being. I think when we think about these issues that are being faced by trans and non-binary people, I think we really need to recognize that their healthcare needs, our healthcare needs are important. That even if when we are focusing on COVID as a situation that is, it's a current situation, we also need to ensure that we're not leaving people behind, that we're not then forgetting that there are other needs need to be met, that even when we are thinking about the policies that you're putting in place, they need to be cognizant of the needs of trans and non-binary people. The right to healthcare is universal. We've all been working towards a universal healthcare, universal healthcare for everyone, and the goal to 2030, but then the current situation that we have continues to put aside people who are in the most need of these services. We keep saying that we need to leave no one behind, but years and years going by, we're still seeing discrimination and stigma being faced by this community. And at this point in time, there's even more heightened discrimination and hatred towards trans and non-binary people. I mean, we can see what's happening in the US and even in other spaces where there's a continuous increase of anti-trans legislation, anti-trans hatred and violence, and just really, really tough things that are happening towards trans people in particular, making it even more and more difficult to actually access universal healthcare and leave no one behind. And I think these are some of the things that as an international community, we really need to have those conversations. We really need to sit down together and discuss where exactly are these issues coming from. Because even when we are talking about rights, you cannot be a person who is stigmatized constantly and still be able to access healthcare. The more stigma that you're facing, the more discrimination that you're facing continues to push you down into the ground, continues to push the community much further underground and not actually have the confidence to access healthcare, to access even if it's HIV care. And what does that then translate to? It translates to increases in mental health struggles, increases in suicidal ideation, increases in suicide, and just makes it that more difficult for us to achieve the goal of leaving no one behind and having universal healthcare for everyone. Thank you.
Thank you so much, Barbara, for bringing up such important points. I hear both you and Hiker consistently say that stigma and discrimination continues to be a barrier for LGBTI, but specifically for trans and intersex persons to access healthcare, which has just become even harder during the pandemic, when parts of our communities cannot access the healthcare that they have traditionally needed and continue to need, but are also not being consulted in programs and in policies that are being created to combat the pandemic. And thank you for raising that the context and the world that we live in is just making it harder, specifically for trans persons, because of the anti-trans rhetoric and the anti-trans policies that are coming up. And so we really do need to centralize these issues and discuss them in much more profound ways. I'd like to move on now to our next speaker, Dr. Tlaweng. Thank you so much for being here today. We are so thrilled to have you, and happy 1-year anniversary, I think, as the Special Rapporteur on the Right to Health. That was just a couple days ago. Apart from being the Special Rapporteur, you are a medical doctor with expertise advocating for universal health access, HIV care, youth-specific access to healthcare, and family planning. You've advocated for all persons' access to their sexual reproductive health and rights, including for safe abortion. And you have been an ally to the LGBTI and the sex worker communities, and address health issues from a perspective of pleasure, which I think is amazing, and which you address in your best-selling book. I think it's safe to say that we are so pleased to see you hold the position of Special Rapporteur, and even more pleased to see the inclusion of SOGI issues and intersectionality in the priorities of your mandate. As mentioned already by both Hiker and Barbara, this past year and prior to that, LGBTI persons have experienced multiple aggravations to their right to health and to their access to healthcare, impacting their overall well-being. Can you tell us what you have mapped so far in your position in regards to the main issues for LGBTI populations, and what information have you received that has impacted this, both due to COVID and otherwise?
Thank you so much, Rashima, for this invitation. And it's really a pleasure to join all of you colleagues. And it's always important, to keep connected. As we all know, the COVID travel restrictions have made it impossible for me to execute some of the ways in which we work in terms of country visits. So, these convenings are especially important for me, to keep my finger on the pulse, so to say, in terms of the issues that are important and urgent. And when it comes particularly to LGBTI populations and gender diverse persons, I, of course, come to this issue from many angles, of course, as a special rapporteur on the right to health, but also as a medical doctor who, even in my training as a medical student, have seen the different ways that medical practitioners have treated children, for example, who were born intersex. I've also seen firsthand how the medical fraternity does not fully include hormonal therapy and hormonal treatments when they are discussing, adolescent health, for example, and it's only about family planning on contraception, when we know that there are many adolescent young people who may need assistance with transitioning and they are left out of the health system. But when it comes to the right to health, the Committee on Economic, Social, and Cultural Rights defines it as an inclusive right. And I think it's very important, that the right to health really is interlinked and interconnected with so many other rights. And it doesn't extend only to the timely access and appropriate healthcare, which we know during COVID has been particularly difficult because of lockdown regulations, because of curfews, because of many people who are living in peri-urban and rural areas. But this right also extends to the underlying determinants of health, such as access to safe and potable water and adequate sanitation, adequate supply of food and nutrition and housing. And we know that many people, for example, in South Africa and Cape Town particularly, there's a trans persons population there, which is continuously being harassed by police, people who are already experiencing homelessness. And in this time of COVID, the bylaws are being used to further police people's movement. And of course, some abuses and violations of rights happen at that level. The other important aspect, of course, is access to health-related education and information, something that I advocate for as long as I can remember. I've been a peer educator in HIV prevention, since I was 20. And a lot of the information, even when at the time it was deemed comprehensive, it still lacked information that was affirming of people's sexual identity, that or orientation, that was affirming of people's rights to be who they are. And I also want to talk about, the fact that the LGBTI population and gender diverse persons deserve these rights despite or beyond just our heterosexual gaze that only looks at them through romantic love, like those love is love kind of thing. It's like, people are worthy of rights whether or not they are in a relationship and they are performing that public displays of affection, which is important because we know in many populations there is still prohibition, right, of even hand holding, even cohabiting. There's criminalization, even of consensual, same-sex interactions. So those are really, really important. And the issues are about human rights. We are just speaking to different colleagues about the issues of gender equality and how people are asking, are human rights important to get gender equality? But it's like, but wait, gender equality rights are human rights. Like, how is that even a question, And so the same we find in the LGBT issues, and especially when you're talking about equality, when you're talking about, the rights to non-discrimination, it's almost as if the rest of the people think they are going the extra mile when they are now being inclusive to the LGBTI community and their needs. And I see this a lot in the medical field. It's very paternalistic still, very patriarchal still. So anyone that is seen to be pushing the boundaries of what is acceptable and what patriarchy will allow gets punished for that. And you see that with sex workers, you see that with intersex persons, you see that, with women, for example, who are just able to negotiate the type of sex they want and are not ashamed to say that they seek sexual pleasure. And so these issues are all connected to all of our rights and freedoms. And they are really an integral element and component of the right to health, because we know the right to health also speaks about, the highest attainment of physical and mental health. And we know the fallout for many is that there's a mental health element that is always neglected. And by the time young people grow up, you don't even have to, there doesn't even have to be a placard that says, in this household, we will not accept you if you are gay. But you hear it, right, from the remarks that people make when they are watching television. You hear it when you are walking around in the streets. So you already know that in this society, I'm not welcome. So you kind of already try to protect yourself in the various ways that you can. And it's only when you are older, and I've seen this with many of my patients, it's only when they are in their mid-20s, when they're economically independent, when they are no longer dependent on their families for shelter, for education, that they can truly come up and be who they want to be. And I think that in itself shows the gross human rights violations. There is no way that we can allow people to be violated, discriminated against, experience inequality, criminalization, only up until there is some class movement, and that then they gain certain protections. And so it's very important to realize that all of the issues are interconnected. There isn't a right to health issue. There isn't an LGBTIQ or SOGI issue. There isn't a right to economic participation or a right to development issue. We will not develop as the human species unless all of us are fully on the table and able to really have fair treatment and access to all of the rights that we need. And by the way, I did a call out for contributions. You were asking about the mapping and how COVID has impacted some of these issues. My report will be coming out to the General Assembly in October. And there I speak very particularly about the different reports that I've received. We had about more than 66 submissions from different areas in the world. And I will be elaborating in that report about the different ways that COVID has impacted all of the different health rights. But very importantly, yes, there has been reports of very clear LGBTI related issues that COVID has compounded.
Thank you so much. I know we're all very excited to see that report and have continued data, especially coming from human rights experts that that showcase all of these issues. But I just wanted to highlight, one of the things that you said, which is human rights are intrinsic to the virtue of being a human. They're not connected to who you love. They're not connected to anything or anyone else, and they are interconnected in the same way that all of the SDGs are. We cannot choose to leave one behind, or we cannot choose to fulfill one right or the other, because doing so will not get us to evolving, as you said, as a human species. I know I'm supposed to go to the next panelist, but I also know that you need to leave soon. So I wonder if I could ask you our second question before you leave, and then I will move forward. Perfect, thank you. In that sense, and connected to what you said in regards to human development, we are less than a decade away from 2030 with an ambition to achieve all of the Sustainable Development Goals. Considering this and considering the impact of COVID and how it has, made us move backwards in this progress, what recommendations or best practices can you share with us to ensure that we advance the realization of SDG 3 and the health and well-being of LGBTI populations with the ambitions of really leaving no one behind?
I think it's important to talk about the impact of violence that many people are living under, even if it's just a threat of violence. I think we don't speak enough and demand enough of our governments to prevent violence and to protect, vulnerable populations against violence and other human rights violations. And I am sure many of you here know the Resolution 275 of the African Commission on Human and People's Rights, which speaks very clearly about, states having to end all acts of violence and abuse whether committed by state or non-state actors, including enacting and effectively applying appropriate laws prohibiting and punishing all forms of violence, including those targeting persons on the basis of their imputed or real sexual orientation or gender identities. And I think for me, as someone who lives in South Africa, I see firsthand the impact that violence has on people's mental health and their ability to be fully participating in society. And I think that's one thing that I can say for me is one of the urgent things. And even now with the pandemic, we've seen how, states used emergency laws and lockdown measures to target LGBTI populations, to target sex workers, to target people who are using drugs, right? And we've seen how the law in itself can be a tool to further marginalize. And so we really have to advocate and amplify each other's work across the different regions. And as an abortion provider, I've got some experience of how, we are able to assist each other in when I was still very much active in civil society on the different, legislative frameworks and policy shifts that needed to happen. And I think even in that space, we have to be very intentional about ensuring that we look at the multiple intersections and not look at just one's identity and leave it there. We have to look at the different ways that power lies and how power moves within people. And of course, we will not achieve SDG 3, especially for LGBTI people. It's still an unrealized ideal. In many cases, even where there is social progress within certain communities, if you had to guess which group is still excluded, it is the LGBTI. And we know in terms of faith and religion, how much that can also play a role. So I think for me, it's about also seeing who are our allies in those sectors that are traditionally very obstructive. I think in some instances, we may find some allies even in those spaces, but of course we mustn't exhaust ourselves, right? Trying to get people on our side. We already have human rights on our side. We have the Universal Human Rights Declaration on our side. But of course, when it comes to everyday life, you do need people on the ground who are spreading the right message. And I think lastly, for me, accountability is really important. We have to demand monitoring and review and redress where we know, especially that violations have happened. We cannot get to accountability without having meaningful engagement of rights holders, right? Who need to be there and to negotiate the language, to talk about budgets and spending. All of those are important. They are not just issues that are for managers or for political heads. Communities should be involved in what happens and what duty bearers do, and they need to explain their actions and be agile enough to make the necessary adjustments. And I just want to reiterate the importance of creating an enabling environment for the protection and promotion of the right to health. But again, as it's interconnected with other rights, and through my work, my commitment is to always, through transparency, aim to build trust and assist, through different remedial work, through the different processes and mechanisms within the Human Rights Council to get to really not have the LGBTI issues as an afterthought. Often when you read work, it's like, oh, they just added that there just so that it looks like there's inclusion. We have to be meaningful. And the way to do that is to be intersectional and to use intersectional frameworks as a means of achieving substantive equality and ensuring that we truly leave no one behind. Because if we don't do that, the UN itself will fail in its own slogan and fail, millions and millions of populations around the world. Thank you very much, Rashima.
Much, Dr. Talang. I just want to just echo what you said, and thank you for bringing up the issue of violence. I mean, so much of our communities still face violence, and this is exacerbating our ability to access healthcare and every other single right. But as you said, our ability to access information and our ability to assemble are being challenged right now with increased laws and punitive laws that Barbara also said, but because of the underlying patriarchal norms, gender roles, and stereotypes. And I think it's really, those are the issues that we have to continue to address, because they are the roots of almost everything and every barrier to access that we have, whether it's to our human rights or to our access to development. So thank you for not being superficial in your inclusion of LGBTI issues and using this intersectional lens. I think that not only paves the way, but continues to showcase the need for all of our communities to work together across the different levels of access to power and power that we have. Thank you so much for your time today, and we look forward to the report. I'll move now to Laurel. Laurel, Barbara and Dr. Tlalang also mentioned that some of the hindrances due to COVID and generally for LGBTI and key populations is in access to HIV and in other critical care needs for our community. During the pandemic, but also before the pandemic, LGBTI persons have faced disproportionate vulnerability to HIV, and this, coupled with, as you've heard, stigma, discrimination, and violence, as well as social barriers and norms, exacerbate this issue. And very recently, UN member states have come together and adopted a new set of ambitious targets in a political declaration at the United Nations General Assembly high-level meeting on AIDS. And there were important commitments that came out from that meeting, which includes scaling up support to LGBTI communities and LGBTI community-led organizations. So I wanted to ask you if you could tell us more about these commitments and the opportunities for LGBTI populations to leverage them to address the health and well-being of our communities and to also hold countries accountable.
Yes, thank you so much. It's really a privilege to speak after the last three speakers. So thank you. And thank you to the Netherlands, to our colleagues at UNDP, but also to Outright for organizing this session. I just, if you'll indulge me, I just want to start by just sending thoughts to our brothers and sisters in Tbilisi, who have been facing such violence over the last weekend related to the Pride March that had been scheduled and had to be canceled. And I think that really forms an unsettling backdrop to the conversation that we're having, because of course, how can anyone exercise their right to health when they can't even walk freely on the streets? So just let's send our thoughts their way. So let me just start first with some quick background on about where we are in the HIV response relative to LGBTIQ people. And of course, I think has been made clear, as we all know, we have a lot of other issues to deal with, and AIDS is not over. And our communities have borne and continue to bear the brunt of the burden of the HIV epidemic and also the HIV response. And this is particularly true of gay and bisexual men and transgender women, but none of us are untouched. Two friends of mine, people may know George Ayala and Andrew Spielden, are the former and current directors of MPAC Global Action for Gay Men's Health and Rights. They recently published an article really boldly titled and correctly titled, HIV is a story first written on the bodies of gay and bisexual men. And I think we need to remember that as this is our history. It's also our present, where we come from. So just to say quickly, while new HIV infections have decreased significantly in all regions and in most populations, we've seen for gay and bisexual men that new infections have increased 25% from 2010 to 2019. And for transgender women, we also see that new HIV infections have held steady, while HIV infections for all women have decreased by 23%. So we really see some inequities, real significant inequities, in fact, in what's happening in terms of HIV acquisition. We know, all of us here, I think, that it is structural factors that drive the HIV epidemic and that drive these risks of acquisition. And this is what we've already heard: stigma, discrimination, violence, criminalization. All of these issues that communities face, our communities face, limit all of our access at every level to HIV prevention, treatment, care, and support services. You know, what we don't talk about very often, I just want to quickly mention, are the other groups in our LGBTQI rainbow and HIV. And so in terms of lesbians, we know lesbians are living with HIV. We know lesbians acquire HIV the same ways that other people acquire HIV, sometimes through sex work, sometimes through drug use, sometimes through sex with men, sometimes through sexual assault. And that's true for every single group in our community. But we also know that lesbians living with HIV have almost no space and no attention in the HIV dialogues, but have very specific needs. For transmasculine people, there's again little attention to transmasculine people and HIV. But the International Working Group on Transmasculine People and HIV has said very clearly that there are specific risks for HIV acquisition for transmasculine people that need attention and people need support. And this includes that, as with each of our communities, we overlap with other risk communities. So many people are sex workers, many people are people who use drugs, et cetera. And so there are these overlapping vulnerabilities that we experience. And similarly for intersex people, there is almost no attention paid to their needs related to HIV, but yet we know that there are intersex people living with HIV. And just to quickly mention, for each of the groups in our rainbow, there are people who've been born with HIV and so who are living with HIV because they acquired it at birth or shortly after. And so just to move forward from there to the new global AIDS strategy that was adopted in March of this year that shapes UNAIDS work moving forward, but also the political declaration that was just adopted on the 8th of June at the high-level meeting on ending AIDS. The focus of both is very clearly titled Ending Inequality, Ending AIDS. And that is because it is absolutely clear that we can't move forward and make progress on ending AIDS if we don't make progress on ending the inequalities that make people vulnerable to acquiring HIV, to becoming sick if they have HIV, and to dying from AIDS. So we know, and but there's also strong evidence that shows that there are two critical factors to ending inequalities, ending AIDS. One is making sure that we have an enabling legal and policy environment so people can safely access the services and care that they need and be treated with the dignity that they deserve. And the other that I'd like to highlight is leadership by communities that, and this goes back to the political declaration commitments. That we know that when work is done by and for the communities that it is intended to serve, that work is better. So HIV services delivered by and for gay men are much more effective for reaching gay men than services created by other people. The same for transgender people. The services, advocacy, programs by and for transgender people are the most effective in reaching transgender people appropriately. The same for every other group that we work with. And so we've worked very much at UNAIDS with networks of gay men, of sex workers, of people living with HIV, of course, people who use drugs and transgender people, to come up with definitions of community-led responses that in the definition say that a community-led response is, to summarize, a peer response. It is led by and for the people it is intended to serve. And so when you see the political declaration commitments that were adopted, you will not see a commitment explicitly to support LGBTI organizations. That wouldn't have been possible to accomplish in this environment. But what you do see are commitments to scale up support for community-led services and written as peer-led services. And so what member states committed to do is to increase support for community-led organizations to deliver 30% of HIV testing and treatment services, 80% of prevention services, particularly for key populations, including women within key populations, and 60% of services to achieve societal enablers, which include work to address stigma and discrimination, advocacy, work against criminalization, et cetera, all of these important pieces that need to come into play for us to have the structures we need to have to be able to end AIDS and protect people's rights and dignity. We also see commitments that fewer than 10% of people living with, at risk of, and affected by HIV would be affected by stigma and discrimination, and that fewer than 10% would have restrictive legal and policy frameworks. And criminalization of LGBT people creates a restrictive policy and legal framework. And so this is really an opportunity to start to push back against those frameworks so that governments can meet their commitments by 2025. So I'm happy to say more about that, but let me stop there and perhaps we can move on to the next speakers and I can add more if questions arise. Thank you.
Thank you so much. I think it's important that you recognize that community-led responses or peer-led responses by and for people are the most effective. And I would say this echoes as well what Hiker said about how intersex-led communities and how intersex-led surveys are very different than when they're done by the general public or even by LGBTI populations. We reach our communities the best when we are the experts in our own lives. Monica, I go to you next. You have been hugely influential in global efforts to push for the inclusion of LGBTI persons in development and in the realization of human rights as an activist. You now work with UNDP, supporting governments to design policies and programs targeting marginalized populations, including LGBTI persons. I think many people in the community would agree with me that having an ally with such profound connections to the community now within the institution of a UN agency is just really wonderful and really recognizes that LGBTI persons, as Laurel also mentioned, are best connected to our communities, are experts in our own lives, and can and should develop programs and policies that are most effective. So UNDP has been engaged in multiple efforts of inclusion of LGBTI populations across the globe, but I was wondering if you could tell us about the specific work that you do in the region, or UNDP does in the region. And considering your experiences, what bridges can be built between various stakeholders to further the goal of inclusion of LGBTI persons?
Yeah, good afternoon, good morning. Thanks, Rashima. I'm honored to be here today. Hiker, Barbara, it's been a while, and under normal circumstances, we would have met at some conference or somewhere. I'm really happy to meet Dr. T. Having read that book, the one that you mentioned, and the Laurel. Thanks for your presentation. And thank you for the organizers as well for bringing us here to address this very important topic. Yeah, and so I'll just get into telling you a little bit about what UNDP has done, in terms of addressing the health and well-being needs of LGBTI people in the region. So I'm going to give a little bit of a background to when it all started, and and end with where we are today. And so, admittedly, UNDP came late to the table, making a real commitment to address specifically LGBTI issues. It started in really 2007, 2006. But before that, other UN agencies worked within the HIV spectrum, particularly, addressing issues of gay and bisexual men. The most important thing was really noting that criminalization across the board, not just criminalization of same-sex conduct, but all sorts of criminalization hampered efforts to prevent the spread of HIV. I think that's really, really important that was noted early on. And WHO, UNAIDS were the main agencies that were working on this particular campaign to get governments to realize that laws, policies, and all ways of sanctioning or criminalizing behavior were hampering the prevention efforts. The other piece of work that was really important was, in the 90s, the removal of homosexuality from the ICPD list of diseases. As you know, from long time, the homosexuality was listed as a disease, and that, it just the idea of it being listed as a disease is an affront to human rights frameworks, and having that success happen and having that happen, the removal from all of that was really important. The other way that UNDP came to the fore was really, they worked on poverty, the alleviation of poverty, the removal of inequalities. And this was really just not focused on specifically on LGBTI, but it kind of worked across sexual and gender minorities, which was also very important. It is also important to acknowledge that HIV catalyzed a lot of the work that UNDP has done, that all UN agencies have been doing. The importance of that is the issue that, as I think today we know that governments still are reluctant to actually address LGBTI issues, but when you come through the opportunities raised through HIV, we are able to get to the table. We are able to sit and discuss issues, to discuss health issues, particularly health and well-being issues, and even bring in the issue of decriminalization, or criminalization in general. And so that was important, that happened. So in 2006, 2007, UNDP, I think, decided to advocate for a more committed role to address issues of LGBTI issues. And they became the lead agency in addressing MSM and trans issues. And so, as I said, that became really important in the sense that, it really centered on brought LGBTI persons to the table to be able to contribute, whether it was, national strategies around HIV, and bringing in all the issues that the other panelists have talked about, whether it's violence, violation of human rights, and how that impacted the lives of LGBTI persons. So the work, although it started small, it expanded, and it is expanded to from MSM and trans persons, it expanded to cover LGBTI more broadly, which is, again, is a really important issue. And then it also expanded not only to cover HIV, but other health and development issues. And again, we've heard about issues of homelessness, poverty, inequality. Those are very important issues that, it's not just about the disease, it's about, well-being, and well-being is a very broad, subject. It includes just all the rights that are intrinsic in being a human being, are important to be addressed in that sense. And so, although it started with HIV, the expansion, that being able to get into the door, and while you are inside discussing HIV, you are able to bring up all the other issues, whether it's economic and social rights or political and civil rights. I think those were important, that that happened. And I mean, UNDP, as you know, most UN agencies work at governance level. And so a lot of the time they have to work with partners and allies to be able to get, a more holistic approach. And, gradually UNDP started partnering with different allies, particularly CSOs. One of the successful partnership was in 2009, partnering with a regional network called AMSHA. It's called African Men for Health and Rights. This is they are based here in South Africa, but they're regional network, which means they cover the Africa region. And so this group was supported by UNDP. They worked together, and they did work on health and HIV, but also the important thing was that, also working particularly at the African Commission to address a variety of issues centering on human rights violations based on sexual orientation and gender identity. The African Commission or any other human rights mechanism are very important platforms to bring to the attention to the states the very specific challenges or violations that people experience in the different contexts, in the different countries, because of the legal frameworks, because of stigmatization, because of a variety of things, religion being one of the other thing that makes that makes it impossible for that brings stigma against the stigma and discrimination against LGBTI persons. They also challenge laws and policies. They challenge social barriers that hinder access to public services, in particular, public services, health services, education, employment, etc., etc. And so this was an important move to be able to work with networks and do this important work. And this collaboration, this support brought about the resolution that one of my colleagues was talking about, Resolution 275. And so AMSHA was a sponsor of this resolution. It involved a long time effort to get the African Commission to pass a resolution that, particularly against, violations against persons on the basis of their real or imputed sexual orientation and gender violence. I think it's important also to understand why there is a real and imputed, because, society, can perceive, some people are perceived to be gay, but LGBTI because of the work they do or what they look like or who they associate with. So as long as you are assumed to be that way, you were put in that same part and treated in a similar manner, which is basically rejected, isolated, stigmatized, discriminated against, violated, and all the other things that have been mentioned. And so this resolution is important today to bring focus at this African human rights platform on LGBTI persons and the specific, very unique challenges that they experience because of who they are and who they love. Of course, there's been a lot of collaborations. UNDP has worked with judges and jurists, magistrates particularly. As you know, the arrests, you go before a court. There's been a lot of strategic litigation, to address some of the violations, to address issues of freedom of association, to address the legal recognition of different groups within the spectrum. And so training judges to be able to respond to these issues, to use international legal mechanisms, to use all these treaties, to use the constitutional provisions that protect individuals within the countries was important to have, the judiciary respond specifically to support and protect LGBTI persons. There's a lot of work that has been done across the world. I mean, there's been one big project in Asia. Being LGBTI in Asia, I think Heike can talk more about this. It's an important, big project that was established in 2014, has made a huge impact on the lives of LGBTI, also in the Caribbean. But there's been a lot of knowledge products that have been produced by UNDP. We've supported the development of guidelines, of tools, of reports. I can think of a few, like the LGBTI indicators, index. That's an important tool today that we continue to use. There's a report on the intersection of LGBT work and SDGs. That's also something that lays down a framework or kind of a baseline. Now, just to your last question, and that I'll use the present project that we are working on, the idea around building bridges. So in 2020, CEDA, which is Swedish CEDA, supported UNDP to launch the Inclusive Governance Initiative. So of course, we've been affected by COVID like everybody else. And so the project has started slowly, but ideally it is to support countries in sub-Saharan Africa to become increasingly accountable to and inclusive of the entire populations, including gender and sexual minorities, right? So we particularly, we work with civil societies, building links between LGBTI activists, LGBTI organizations, and linking them with human rights organizations, linking them with everyone and all the other allies to be able to address holistically all the needs of LGBTI. We also work with governments. We basically linking and expanding the circle of supportive decision makers, right? So we are looking at judges, I've already mentioned judges. We are looking at parliamentarians. We are looking at ministers, civil servants, and linking them as well with resources, linking them with civil society. UNDP has, the ability to convene, at that level, and therefore leveraging on that ability to bring, all these, persons, resources working on LGBTI together to be able to address all these issues.
I'm going to stop you there because I feel like actually what you're saying now will lead to an answer to the second question.
Yeah, thank you.
But thanks so much, and I think that it was really important for you that you mentioned. We need to use the entry points that we have to get in the door, and as you said, we need to work with partners and allies and across different stakeholder groups to get us there. I have one question for the rest of my panelists, and I know that we're running quite far behind in time, so I'll ask that we I ask that all of our attendees pardon us that we don't have time for a Q&A, and that our panelists keep their answers short and concise, which is, I have a question for all of you, and this is the same question that I asked Dr. T. We are less than a decade away from 2030, with an ambition to achieve all of the Sustainable Development Goals. Considering this and considering the impact of COVID on the health and well-being of LGBTI persons at large, what recommendations or best practices can you share with us to ensure that we realize SDG 3 and we truly leave no one behind? Heike, I'll throw it to you first.
Okay, thank you. I think for us, just like I said, that discrimination actually is a serious issue here, and it creates so many impacts, especially during the pandemic. So actually, there are some countries started, some activists in some countries started to advocate to include intersex, to include sex characteristic in the national anti-discrimination law. I think this is one way that we can take to leave to not leave intersex people behind. And I think it's still hard because discrimination actually from people that are innocent. Many people discriminate intersex people, but they have no idea what intersex people are. So I think it's very important to include intersex people knowledge in sex education, and in a positive way. So we are not supposed to be always to be seen as a patient and needs to be normalized by the doctors, and to include intersex people in the protection. I think to include intersex people in the census is also a very key issue. Otherwise, how we identify who are intersex people and how can we support them. So we don't only need visibility, but we need acknowledgement as well. And so intersex people in this way can be included in all SDGs protection. For us, I think the personalization, intersex people is the main goal for intersex movement. But I think to eliminate, social discrimination and self-stigmatize and inclusive intersex people positively is something that we need to do. And also, like in our medical system, I think the proper and friendly medical protocol is need to be formed, because now the mainstream is still try to make intersex people as male or female, and most of the time without informed consent. So this is something very important. And no matter what the policy need to be done, we hope that intersex people can be included in the discussion, because nothing about us without us. Please remember that. And I also discovered that in some UNDP in Asia country, they know nothing about intersex issue. And I really hope that not only states, especially UN agency, can take the lead to raise intersex awareness within their institutes across the world, and I think I want to say that intersex-led organization in the country can help, and the Intersex Asia can also help. So please let us help. Thank you.
Thank you so much for that, Hiker. I'll hand it over to you, Barbara.
Thank you. And this has been a rich discussion. I really enjoyed it so far. I did mention a little bit about what are the best practices we can think of when we want to improve access to healthcare and reach the goal and the realization of SDG 3 and leaving no one behind. I think it is important for our governments and our communities to enact laws and policies against stigma and discrimination. As Hika has mentioned, I think it's important that our constitutions expand the understanding of non-discrimination on the basis of sex to also include sex, gender identity, sexual orientation. And I understand that this can be an overreach, especially in the African settings. But I do believe that we need to be able to work with our court system and ensure that when we're talking about discrimination against gender, that it also includes gender identity and sex characteristics and so on and so forth. I also think that it is important that we work towards enacting policies that are actually addressing the issues on, providing trans and non-binary people with gender affirming care, specific gender affirming care that is including say, hormone replacement therapy, access to surgeries, and access to mental health and well-being care for trans and non-binary people. I think this one thing that I feel like is a far reach also, but might be able to help us in future, is expanding comprehensive sex education to also include understanding gender identity, gender expression, sex characteristics. I think it is important that young people also have, when they are talking about sex and gender, when they're talking about their own sexualities and their bodies, I think it's important to also include people learning around the variations of sex differences, gender identities. I think it is important when we have that kind of information being given to young people, that then the understanding grows beyond our own generation. I think it is important to have affirmative action in terms of against discrimination and stigma, especially in health settings and medical settings. And so it's important that when we are doing our trainings, and especially in terms of training new healthcare workers in colleges and universities, that we have also inclusion of understanding stigma and discrimination against non-binary people, trans people, intersex people, that understanding is inculcated in the curriculum, is inculcated in their retraining and all the discussions that are happening, so that then any trans person, any non-binary person is able to access healthcare, irrespective of how they look like, irrespective of what their identity is, and what documents that they carry. I think it is also important that there are laws and policies that address the structural barriers, such as the laws, the ability to change your name, the ability to change your gender marker. These are things that are also affecting access to healthcare. And you understand very well that if my appearance does not match my ID, then it can be a barrier to me accessing a service from a public hospital where they do require me to present my identification document. I think it is also important that training, and not just training for current people within, first responders such as healthcare workers, police, government workers who are meeting people directly. I think it is important that training against stigma and discrimination is addressed and is given to these people, because these are the people that we interact with on a daily basis. Yeah.
Thank you so much, Barbara. And over to you, Laurel.
Thank you, and I'll be brief. I want to go back to the commitments in the political declaration. The declaration is available online. A lot of advocacy went into getting those commitments into the political declaration, but that's only the start, really, because none of those commitments will actualize themselves. They will take committed advocacy by communities to make those happen. And so I think there are really critical entry points and opportunities for LGBTIQ plus communities in those commitments, particularly in the commitment to end discrimination and stigma, essentially to change punitive laws and to scale up support for community-led organizations. And I think particularly we need to all mobilize around the community-led organizations at country level who are in the front lines and know exactly what they need in order to maintain, protect rights and dignity, but also maintain their access to health services. Thank you.
Thank you, Laurel. And lastly, Monica.
Thanks. Yeah, I think a lot has been mentioned. So just add a couple of points. So in addition to just acknowledging LGBTI, putting them at the center of the efforts to achieve the SDG targets, I think one way to make sure that the work is intersectional and continues is to link the various human rights mechanisms, the work that has already been done, with the SDGs. There are lots of recommendations coming out of the UPR committees, CEDAW, and you name them. And yet, when you get to voluntary reviews, national voluntary reviews, there's no mention in most of the countries of LGBTI inclusion. And you wonder why when there's already all these recommendations. And I think we have to use all of that information, all that data that has been collected, it's there, and use it to hold accountable, use it to develop ways, to report and hold accountable our governments. And I think that it's important to link in that way. Countries already have an obligation to protect, respect, and fulfill. And although that is only, that comes out in international law, I think, SDGs are based on the same principles. And so the connection is very easy. We shouldn't really be floundering around, not being able to find the right thing. I think funding is also important. The funding, there's a lot of complaint, around funding going to HIV, going to MSM, going to, leaving others behind. All of that. I think the real issue is, it's not that there's funding going to this, because I think there's still not enough funding going to all of the spectrum, the LGBTI people. Instead, I think there has to be increased funding, and there has to be, data collected so that we understand where the gaps are. Why are trans women, experiencing the exacerbated, violence or human rights violations, and then addressing those issues. I think it's important in that sense that funding should not be reduced, but rather increased in targeted ways, and it should be based on the needs of the LGBTI persons themselves. And LGBTI persons know the needs themselves, and it shouldn't be somebody else coming to tell them what to do, but rather it should be grown from the local communities. It should be developed within the communities. All, the solutions, the answers, and the way to respond to the COVID-related issues as well. I think, the SDGs have to be addressed also across the spectrum. So you integrate everything so that you address all of these issues, because human rights are interdependent, they're indivisible, they're universal. So leaving one of them unaddressed, it impacts all the others. And so I think that's my last very brief contribution. I think, if we can do it that way, integrate, think about well-being as a very broad concept that addresses all the issues, including poverty, unemployment, homelessness. It contributes to your well-being. I think we'll come closer to being able to achieve the targets.
Thank you all so much. And just to wrap up from what I've heard today and what I've heard from you all in what we need to achieve SDG 3, as you said, we need to address stigma, discrimination, underlying root causes of these issues, including criminalization and other punitive laws, and truly address the structural issues like patriarchy and other systems that continue to oppress LGBTI people. We need to ensure and protect access to information, which includes expanding comprehensive sex education to include gender identity, expression, and sex characteristics, and also work against punitive laws that are continuing to come up against our communities. We need to think about how to be truly inclusive and not at a superficial level, and to bring LGBTI people to the table to develop policies. We need specific funding and budget lines